Hi, welcome to Real Talk the Interviews, a series of interviews of the members of the Vernon ROCKS Coalition to have real conversations about substance abuse prevention. My name is Skylar, and today we have Kaitlin Carafa with us from the Village for Families and Children. She's the prevention coordinator for the Vernon ROCKS Coalition. Thank you for joining us today, Kaitlin.
Thanks for having me, Skylar.
Before we get started, we want to give our viewers a chance to get to know you a little better. So we have this wheel here full of icebreakers. Would you like to spin one?
Sure. I knew I was going to get this one. So I actually don't have a high school superlative. I don't remember getting voted for one, but I was in middle school. I got voted for Best Smile, but it was pretty much because I didn't have to have braces and everyone else still had braces. So I think that's probably why.
I think that definitely carries over into high school.
Okay.
Yeah.
Thanks.
Would you like to spin again?
Sure. Okay, superpower?
Yeah.
I think I would like to be able to be invisible, so I could kind of like spy on people and like they wouldn't know I was there, or maybe, you know, have a little bit more time to myself because people wouldn't know I was in the room or something.
Cool.
Yeah.
Those are very valid reasons to want to be invisible. So to give the viewers a better idea of what the Vernon ROCKS Coalition is, can you talk about the role the Village for Families and Children has with the coalition?
Yeah, definitely. So about 3 years ago now, the Village for Families and Children, which is an agency that's based out of Hartford, merged with KidSafe Connecticut, which is a Vernon-based agency. So they kind of became like the parent agency of KidSafe. And being new to the Vernon community, they kind of were meeting with some of the different partners in Vernon to try to figure out what different programs or needs there were in Vernon, and they identified that substance abuse prevention was a strong need. There wasn't really any programming going on for that at the time, so they applied for a grant that we received through the Department of Mental Health and Addiction Services to focus on substance abuse prevention. So it works really well with the mission of the village, which is to create communities that provide healthy and stable environments for children to be nurtured and to grow.
Okay. So you kind of already explained this a little bit, but what are the goals of the village?
So, you know, it's really just to provide programs to help families and children. Our slogan is kind of where real change happens. So we're really just trying to make change and meaningful change in both the lives of children and their parents. So we have a ton of different programs. We've got like over 40 different programs. We have a couple locations in Hartford. Those are the main locations. And then, like I said, we now have the Vernon location, and there's some smaller branches in like Meriden and Middletown. So we really cover a large geographical area. And so we have different programs from prevention, like we have, to different intervention and therapeutic programs. There's a financial center, which helps families with budgeting and career coaching to be able to get better jobs and improve their financial stability. With that program, there's also the volunteer income tax assistance program that's going on right now. So that's a free program for families to have someone do their taxes for them for free rather than having to pay to get that done. So we actually do that at KidSafe, and then about 25 other locations throughout the state. There's programs like foster care and adoption services. There's other community support programs where we just help families that need different programs to help them, whether it's with their children or with themselves.
Awesome. So what are the goals of the coalition?
So the Vernon ROCKS Coalition, our mission is to provide resources and outreach for community knowledge and success to prevent youth substance use. So we specifically focus on underage drinking prevention for ages 12 to 20. And prescription drug misuse prevention from ages 12 to 25. So we're really just working with all different people in the community to create different programs and strategies that help prevent kids from using substances.
So how do you identify which substances to target?
So we have a couple different methods that we use. When we first received this grant funding, we kind of went through a revamping of the coalition, and at the same time we worked on a community needs assessment where we looked at state level data, regional data, and some data that we had from Vernon, from high school students on reporting how often they've used certain substances, what their perceptions of harm are, if their parents have rules against using alcohol or other drugs, and then some other community factors like police department data, how many people are getting DUIs in Vernon, how many people are getting arrested for certain drug violations. So we looked at all of that data to kind of decide that alcohol is a major problem. It is everywhere across the nation. Unfortunately, a lot of people, not just kids, abuse alcohol. So we felt that that was a strong thing that we should target, whether or not that means that Vernon kids are using it. We thought that that was an important thing to prevent. And then as well as prescription drugs, because that's kind of the leading gateway into people then moving on to some harder opioids like heroin or fentanyl. So we wanted to really prevent that because that's such an epidemic going on right now.
Right. So last month, Michelle Hill gave us a brief introduction to Real Talk. Can you tell us a little bit more about the campaign?
Definitely. So this show is sort of a part of Real Talk. Real Talk is all about having those hard conversations, whether that's with the community or teens having it with their friends, and parents having it with their children. So talking about the dangers of using alcohol or other drugs and kind of the consequences that can happen if you do engage in those behaviors. So Real Talk is a campaign that we hope continues on for a while. So it started with a focus on underage drinking prevention. So a group of young people got together and kind of created the logo and the name and kind of the theme of what they thought young people would relate to. So they kind of thought doing a high school superlative theme and having the campaign look sort of like a yearbook would relate to teens, because one of the major milestones, obviously, is graduation and a yearbook. So they came up with the layout, the picture, all the language. They presented to the Board of Education and the Town Council to publicize the campaign and talk about how they came up with what they did. There's been a few billboards. There's been posters put up all throughout the town. There was actually 25 different either businesses or town agencies that agreed to put up our posters. So that's really cool to see that the community is supporting our messages. We've been doing this show and some advertising on social media. So it's really been progressing.
So where's the campaign at right now?
So right now, we're doing this show. We hope to every month interview a different coalition member or a different person who is from the Vernon community that relates to substance abuse prevention. In addition to that, we are in the works of a new version of the campaign that aims to prevent youth from drinking after prom. So we're still very in the works with that, but we have a billboard that will go up in mid-April and run through mid-May, and that will be specifically targeting prom.
Great.
Yeah.
So will there be any other billboards this year?
Yes, actually right after that one, so mid-May to mid-June, will be a billboard with our Change the Script campaign. So if you see that poster behind you, that's an example of the Change the Script campaign. It's a statewide campaign that was created with the Department of Mental Health and Addiction Services and the Department of Public Health. That campaign specifically targets prevention of prescription drugs and other opioids. So we're going to have a billboard that goes along with that campaign. And we also have a radio ad that's going on right now, and I believe you might have recorded that ad for us.
I think I recall doing that.
Yeah, it came out really well.
Yeah, thank you.
You're welcome.
So what are some of the ways that the coalition has gotten involved with the community?
So the coalition tries to get involved with the community as much as we can. There's a lot going on, so we try to be at whatever we can be at. So there's a lot of different agencies that have events where they welcome groups like ours to come and set up a table and provide that community education piece that we really try to do. So some of the events that we've gone to have been National Night Out. We always try to go to that every year. So that's really put on by the police department and the Rockville Downtown Association, I believe, and the Vernon Community Network. And so we go to that, and the whole purpose of that is to get community and the police and the fire department, those types of agencies, to come together and connect. So it fits in perfectly with our mission. So we always go to that. There's the Greater Vernon Holistic Health Fest that the Vernon Youth Services puts on, so we go to that as well. We always bring our wheel, which brings people to our table because they're like, ooh, what's that game? So that's one of our better investments that we've made, this wheel. There was a Vernon Seniorhood Fair that we went to this past year, which was really awesome. So that's a community fair that has all different services that are available to seniors in the Vernon area. So we actually set up a table and had one of our coalition members, who's a retired pharmacist, sit at that table with us. So that was a really awesome thing for him to be at. So he was able to educate seniors about their prescriptions and making sure that they're disposing of them correctly and taking them correctly, and kind of giving them that background that I don't necessarily have. So that was really awesome.
So you mentioned before that you guys do community surveys. Can you tell us a little bit about that?
Yeah, so at these events, we have a community survey that we take with us, and we usually try to provide an incentive for people 18 and up to take the survey. And it's those same survey questions, similar, that we ask high school students. So it's really just to get a grip on what substances they might be using, or what substances might be a problem in their home, what their perception of harm is, are there any rules in their home, those types of things. And then also at the end of that survey, we collect information about where they've heard of Vernon ROCKS. So that way we can tell, like, are people going to our website, are they going to our social media, those types of things.
So you talked about before about the events that you've attended.
Yep.
So what are some events that the coalition hosts?
Okay. The coalition has been doing more hosting of our own events lately. So I know Michelle last week talked about our basketball tournament that we've had twice, and then our opioid forum. So in addition to those, we always participate in the DEA drug take-back days. Those happen in April and October. We partner with Walgreens and the police department on those. We do compliance checks we try to do them in the spring or summer every year. And what compliance checks are, in case you don't know, are where we partner with different agencies. So if we're doing tobacco compliance checks, it's with the Department of Mental Health and Addiction Services, and they come in and partner with us and the police department, and they have young people go into different convenience stores or gas stations that sell tobacco and try to purchase those items without an ID. So that way we can tell if that's a problem, if there's specific stores that continually year after year are selling to young people. So we did that last year for the first time on our own to try to get them to buy vapes and e-cigarettes, because that's such a concern in the community right now. And then 2 years in a row now we've done the alcohol compliance checks, where it's the same thing, where young people go into stores and try to purchase alcohol. So those are really successful events, and they help us with our data collection part as well.
So the block party has been thrown around a little bit, so
Yes.
Can you tell me about that?
Yes, so that was a new thing that we started last year, and we really hope that it becomes an annual event. There's a thing every May, it's called National Prevention Week, so it's everyone around the nation is celebrating it at the same time. So each day that week focuses on a different substance. So one day will be about preventing alcohol, one day will be about preventing marijuana, preventing suicide. So it's not just drugs, it's also like some mental health promotion as well. So to kick off National Prevention Week, we decided to host a community block party. And to kind of tie off of our coalition name, we called it Rockville Rocks because there's Vernon and Rockville, so we kind of wanted to make sure we were including both town names. So at that block party, it was a resource fair, so we had, I want to say, like 25 to 30 different community agencies, whether it's treatment agencies, the DEA was there, there's a couple of recovery community agencies that were there, just to give out information about their services and what they can provide to people in the community. In addition to that, we had some fun events. So we had a face painter, we wanted to have a bounce house and some fun outdoor games, but unfortunately it rained, so we didn't get to have those events. But we really hope that that happens this year, that it's beautiful weather, and we're going to have a rain date just in case. And it'll have some of those fun activities that families can come and do that, but then also get that resource and treatment information in case they need to have that information.
So was the block party as successful as you hoped it would be?
It was pretty successful despite the fact that it was raining. I think we ended up having about like 125 people attend it, which was great. Some of the families that came were like pretty young children, so it was a little too early to be talking to them about not drinking or using drugs, but it's really never too early to expose them to different fun community events and let them know that agencies like that exist to support them. So I think it was pretty successful, but we're going to top it this year.
Yeah,
I know.
definitely.
Yeah.
So what's TIPS training?
Oh, so TIPS training is a training that we've done for alcohol liquor stores, but then we also did it for there's an annual brew fest that just started in Vernon, where there's a bunch of breweries that set up tables and then people come and try the different samples of beer. So we were a little bit worried that that was a new thing coming to Vernon, and it's all volunteer run. So we thought, do these volunteers know how to properly check an ID to make sure that the people who are attending this event are of legal drinking age? So that's what the TIPS training is. It's to train people on how to check for the different things on an ID that could maybe hint that it was a fake ID. Also to try to give them some tips on how to de-escalate some situations if maybe someone needs to be cut off because they're too intoxicated. So we hold those at the police department so that, if there's any questions about any legal things or anything like that, they're there to help support us with that.
Great. What are Parks and Rec activities that you're involved in?
So last summer we had a high school student who interned with us, and one of her activities that she managed was to create some fun games and activities that we could do at the summer camps at Henry Park, which is run by Parks and Rec. So we did that for their teens there. I think the ages were 10 to 15. And the student who was working with us created a scavenger hunt game, which was really fun, where the kids went and found, they had clues, and they went and found different things that you can do to de-stress or to have fun with your friends, giving them different ideas of things they can do instead of turning to using alcohol or other drugs. And then she also made a bingo game that had a couple different categories, like ways to say no and some of the facts about the dangers or what can physically happen to you if you're smoking or drinking too much and all of that. So it was really fun. And we gave them prizes and popsicles, and it was fun summer activity.
Incentives are important for
Right,
that age
exactly,
group.
yeah.
So we've talked so much about your past events. So what are some events that are coming up soon?
So coming up in April, at the beginning of April, April 4th, I believe, is when we're gonna have it, is a Narcan training. So this is probably the third Narcan training that we have had, and Narcan is the opioid reversal drug, so it's very easy to administer, and it's a nasal spray that you just squirt in someone's nose if you think they've overdosed. And since it's so easy to administer, it's really important to get that out to the community so that if someone has a loved one that is using drugs, they can have that on them just in case. You always can think of people who know how to do CPR. If someone's having a heart attack, they would immediately react and do CPR. It's kind of similar to that, where it's such an easy thing that if you think someone's overdosing, if you have Narcan on you, you can just easily give that to them. So that's coming up in April. We're gonna have that at the Rockville Public Library so people can easily access that training. We have a doctor who's actually going to do that training, so that's a really awesome new partnership that we have.
So do you know if there's, off the top of your head, if there's a high success rate of the Narcan usage in reversing an overdose?
It's super successful. A lot of times, unfortunately, people will give the one dose and then after a couple minutes it wears off and the person will overdose again and they need an extra dose. So sometimes people have 2 doses on them, and if not, as soon as you administer it, you need to call 911 so that the police or the emergency services can come and do it. So, there's been a ton of reversals, which is awesome. We're saving lives, but unfortunately, we do see a lot of repeat uses. So the police department has identified that, they're kind of going to the same houses sometimes because those people really need to be connected to treatment after they've been overdosed and been reversed. So,
right.
Yeah.
So what is the vaping and e-cig education that you do also?
So vaping and e-cigs is a really hot topic right now. Over the past couple of years, it's really increased, partially maybe because of the fruity flavors that is offered, and it's easy to conceal, and it doesn't really smell like a typical cigarette would smell. And it's not as harsh on, kids your age wouldn't want to smoke a cigarette, that's nasty, but the vapes are, not as harsh on you. So the Rockville Public Library actually reached out to us and asked us if we could hold a training there to talk to parents of teenagers about what e-cigs look like, what the harms are, how they can talk to their kids about not using them. And I think they might also open it up to teens to go to if they would like to go.
That's great.
Yeah.
So how are you able to determine what works and what doesn't work?
So we have a local evaluator who works with us. So she kind of analyzes all of our data for us to say, if we're being effective or not. At those community surveys that I mentioned that we've done, there are, in addition to the questions about where have you heard of Vernon ROCKS, there's some other questions that help us determine if at our events they're learning more about certain things or not. So that helps us know if they're learning and if they're meeting the objective that is the reason why we're there. So that's mostly how we know.
So what's the biggest change that you've seen in your time with the coalition?
So in the past 2.5 years that I've been working with the coalition, we've really grown in how many members we have, especially with our youth members. The beginning phases were more about kind of thinking about who we needed to involve and what we wanted to do. It was a lot of planning, and now over the past year, we've been actually able to do more things. So that's been the biggest change, and it's been really awesome. Having all of the youth members of the coalition has probably been the best part of it.
That's great.
Yeah.
So is the coalition currently looking for more members?
We're always looking for more members. Some of the different areas that we really need more members are parents, faith-based agencies, local businesses. We do have the pharmacies, but we'd love to engage some more businesses. and some just civic and volunteer agencies. We're always looking to expand our membership.
So I think we have time for one more question.
Okay.
What is your favorite part about working with the coalition?
Well, I guess I kind of already hinted at it, but I think doing things like this, working with the youth members of our coalition, is really one of my favorite things. You guys are all great, and you bring such energy to the table, which is really awesome. And I really think it's really cool just being able to work with all these different agencies. You know, growing up, I never thought I'd be working with the police department or talking to the superintendent of schools or the mayor. So I really think that's just an awesome thing to see how much the Vernon community really appreciates partnering and working together.
Well, that's all we have time for today.
Okay.
So thank you so much for joining me today for Real Talk, Kaitlin. We loved having you.
Thanks.
For more information about the Vernon ROCKS Coalition, please visit vernonrocksct.org and follow us on social media at VernonRocksCT. Thank you for watching, and we will see you next month for another Real Talk.